Hi guys, welcome to your lecture on vital signs and physical exams. So I wanted to start out by showing you where you can find the PowerPoint and a copy of the notes. So once again, we are in Unit 2, and I will highlight that here. So we're in Unit 2, and we are in Module 4, and you will need to scroll down just a bit here. And too far. And here you go. Here is the PowerPoint we'll be going through. It's on clinical exams, vital signs, and physical exams. And then right underneath here is a copy of the notes if you don't have them printed out for you. So the PowerPoint and the notes, and that is again all in Unit 2 in Schoology, Module 4. All right, well, let's go over the notes first before we begin. And I have a copy right here. So here are some terms to know. We always start out with a few terms to know. Those are arrhythmia, a fluctuation in the heart rate, auscultation, that's to listen to something like the respiratory system, the cardiovascular system, or the digestive system with gut sounds. Bradycardia is a slow heart rate. Cyanosis is having a bluish color to the skin or the mucous membranes. That's a lack of blood flow and oxygenation in the body. Dyspnea is difficulty breathing. Eupnea, normal breathing. Gastrointestinal, just a term that describes the stomach and the intestines. Murmur is an abnormal heart sound. Usually means like the backflow of blood as it's flowing through the heart, like a valve isn't quite working right, keeping the blood pumping through the right way. We have palpation, that's to touch or feel the structures of the body. Ophthalmoscope, and it's an instrument to look at the eye. Otoscope is an instrument used to look at the inner ear. I'm sure you guys have seen those or had those used on you at the eye doctor or the doctor. Tachycardia is an increase in the heart rate. Sometimes this is due to fear, pain, exercise, certain heart diseases or conditions. And then tachypnea is rapid breathing, kind of like something panting would be tachypnea. All right, then as we move down through the notes, we have what a healthy animal looks like. It's good to know what a healthy animal looks like. Your animal looks like when they're healthy, so that you know when they're not, and you know right away. Here we have a chart with some normal temperatures, pulses, and respirations for the different animals. You'll notice that the bigger the animal is, the slower the heart rate, the slower the respiration rate. The smaller the animal is, the faster the heart rate, the faster the respiration rate. We have some notes here that you can take when we discuss taking a temperature, taking pulse, and respirations. And then here are the words in writing that you will hear me say as we work our way through the PowerPoint. So the things that I will say to you are written here, and more about palpation, auscultation, the lungs, the heart. And then we have the 12 areas that we examine in an animal. So if you've been to the vet before with your animal, as they're talking to you and gaining information from you about your animal, they are also moving through the animal's body and examining it. And these are the 12 areas that they go through every time to make sure that they examine the whole animal. All right, let's move on to the PowerPoint. So I have that open here, and we will get started. So a healthy animal has a clear, bright eyes with pink mucous membranes around the eyes. So the mucous membranes, if you pull down on the lids, you can see that mucous membrane, and it should be pink. If it's white, that is a problem. There is a serious lack of blood flow, oxygen. Something's not right. So you always want to check those mucous membranes. You can also check the mucous membranes in the gums of the animal as well. An appearance of contentment, so they don't look nervous or worried. Yes, sometimes they do get nervous and worried as they come into a vet office. It's new, it's different for them. Some animals get more stressed than others when going to places like that. But if you give them a few minutes, or before the vet comes in, maybe they glance through the window and they see that, you know, the dog is just laying on the floor, or the cat is just sitting in the crate, pretty content, next to the owner. An alert attitude and interested in their surroundings. So a lot of times, you know, our dogs in the classroom lay around and sleep. That's a sign of contentment. But if, you know, things are happening, or somebody, you know, comes to the door or something, they do, you know, perk up their head and are interested in what's going around them. A good appetite, so eating and drinking well, that is important. A sleek, shiny coat with hair that is pliable and not dry or brittle. So that has a lot to do with long-term digestive health, and seeing the effects into that shiny coat, that they're getting fed good nutrition, and that they have good nutrition, and it shows outwardly in their coat. Feces and urine are easily passed and normal in appearance. So it is a thing to look at our animals' feces. I do it all the time because I want to make sure that what I'm seeing is normal for that animal. So it's important to take a look at the feces, and to watch your animal urinate. Are they frequently urinating, you know, or going to the litter box a bunch, or are they going around the yard and peeing little bits here and there? For Jack, that's normal. He marks all over, like 5-10 times. But for other animals, that might not be normal. I mean, Violet, she goes in one spot in the part of the yard, and that's it. She doesn't go little bits all over. If she were to change her behavior, I might start to think something like a urinary tract infection or something like that is going on. So it's very important to know normal for your animal, and not everybody's normal is the same. Same with humans, same with animals. So that when things are abnormal, you see it quickly. You can describe things to the veterinarian so that they can make good choices quickly to get your animal back and feeling good again. And then temperature, pulse, and respiration in normal ranges. So it is a range, as you guys have probably realized, as you take your temperature every day before you come to school, that there is a fluctuation of normal for you, but you stay pretty much around, you know, the same number. So do animals. So temperature, pulse, and respiration in those normal ranges is important. A fever might indicate an infection. Increased pulse or respiration can indicate pain. And so we just want to make sure that we know the normal for that animal, just like we know the normal for us. All right, so here are those ranges. So cats, right around 100.5. Cats can be tough when they come to the vet because they do tend to get stressed out, and these numbers can fluctuate. So you really have to go off the history of the the owner, and has this animal been acting normal and stuff like that, because a lot of times they can get stressed out. Cattle, 101, rectal temperature, pulse 60 to 70, and respirations 10 to 30. Chickens, 107 is their temperature. And then their pulse, 200 to 400 beats per minute. That's a little hard to count. And then respirations. Dog, 102, 70 to 120. That's a huge range. And it has to be that way because we have little Chihuahuas and then we have big Great Danes. So depending on the size of the dog, so your little Chihuahuas are going to be closer to the 100 and stuff like that. Your Great Danes are going to be closer to that 70 number. So it just depends on the size of the animal. Goats, we have 102.5 with a pulse rate of 40 to 60, and then 12 to 20 for the respiration. Horses, right around 100. Normal can go up to 101.5. Anything higher than that, I would say they're in the fever range. Pulse rates, 30 to 60. That depends a lot on the size of the horse. So is it a draft horse? Is it a foal, a younger horse? And then respiration is 8 to 16 beats per minute. Rabbits, 103. Again, that pulse rate very high for this animal, and respiration rate. And then going down to the snake, well, snakes are cold-blooded animals, so whatever temperature that animal's habitat is at is the temperature that animal will be. Pulse rate per minute is about 12, and respirations is only 1 to 2 breaths in a full minute. So that just kind of gives you an idea of different animals and how it differs with the size of the animal. All right, so taking a temperature. Variations in temperature, I did talk about this, could mean infection or disease. It could still mean excitement and stress. And then it could be the environment. If it's hot outside, well, their temperature is probably going to be a bit hotter. Those are some variables for an animal's temperature. We typically do not use the older thermometers, the mercury thermometers, the glass ones. We have digital thermometers now. It's still important for you to understand using a mercury thermometer, because there might be some veterinarians out there still using them. You do need to shake that mercury thermometer down for the mercury to drop. You do want to make sure that you're not shaking it near a table or something like that where it could break, and then that mercury would spill out on the floor. That is a hazardous substance and would need to be cleaned up quickly. So typically we do use digital thermometers, much nicer, quicker. You do want to use lubricant on the tip of the thermometer, and then just gently insert it into the rectum and hold it in there. Digital thermometers can take 30 seconds to a minute and a half, depending on is it still reading an increase in the temperature. So and then after you're done with that thermometer, you want to remove it from the rectum, wipe it off. You want to notate the temperature for the animal, and then put it back to where it belongs. Feeling a pulse. So in dogs and cats, you can feel the femoral artery for the pulse. And I put my fingers on the inside of the dog's leg, and so I feel the pulse go across my fingers like this. So you put it on the inside of the dog's leg or cat, and you can feel for that pulse. And then you would count for 15 seconds and then multiply by 4. and that gives us beats per minute. And that's very important because we talk in beats per minute. We don't give me, how many you counted in that 15 seconds. I want to know beats per minute. That's the number I recognize. That's the number we all talk about, beats per minute. So that is the femoral artery in the hind leg, and you can feel that pulse. In large animals, horses and cows, you can feel the facial artery, which is right underneath the mandible. So you push up on the mandible, the bone, the lower jaw, and it kind of feels, to me, the best way to describe it is a Twizzler. Kind of feels like a Twizzler, and I use my 3 fingers here. Here we go. 3 fingers to feel for that Twizzler, and then to feel the pulse go across. And you count for 15 seconds again, and then you multiply by 4 to give you the beats per minute. So here's the pulse. Variations are due to anxiety, stress again. Exercise will increase your pulse. That's not a bad thing. Pain does increase the pulse. Disease can. If the animal's in shock and has lost some blood, the heart's going to be pumping like crazy to try to keep what blood it has in the body going through the body to help oxygenate those vital organs and stuff. So that will increase the heart rate being in shock. And then by species. So we talked about those bigger species having the lower heart rate and those smaller animals having the higher heart rate. So we talked about putting your fingers over that artery to be able to feel the pulse, and then counting for 15 seconds and then multiplying by 4 to get how many beats per minute. You can also auscultate and listen through a stethoscope, and you put that stethoscope over the animal's heart, which is usually on the animal's left side, is where you want to listen. Yes, animal's left side. Sorry, had to double check and make sure my right and left were correct. In horses, it's right behind the elbow on the chest wall is where you want to listen. Same with dogs and cats, right behind the elbow against the chest wall is where you would put the stethoscope to listen for that heart rate. And again, you count the 15 seconds. And you multiply by 4. And what you'll be counting when you're listening, when you're auscultating, is lub dub, lub dub. So it's lub dub 1, lub dub 2, lub dub 3, lub dub 4, lub dub 5, so on for 15 seconds. All right, respiratory rate. Respiration is evaluated by looking at 3 parameters. So the respiratory rate, so counting how many breaths the animal takes over 15 seconds. So the chest wall will come out and come in, that's 1. Out and in, that's 2. Out and in, 3. And then you want to look at and then you count for 15 seconds, multiply by 4. That gives you the breaths per minute. And then you want to look at the depth, the degree the chest effort needs to make that breath. So is it a deep breath or is it just shallow breathing? So panting would be like shallow breathing. And that can be normal if the animal's nervous or was just running around. That panting can be normal. It can also be a sign of a problem as well. So it's good to know, did the animal just come in from running around? Is the animal nervous? During the visit, does the breathing change and go back to a more normal breathing? And then the character, is it slow? Is it rapid? Is it normal? So the procedure is to observe the rise and fall of the chest. So that's, the lungs expanding and then exhaling out the carbon dioxide. So you count for 15 seconds and then you do multiply that by 4. Here are the 12 areas that we examine every time we see an animal. So their general appearance. Do they seem healthy overall? Bright eyes, the coat. You put your hands through the coat in both directions to look at the skin. So you want to feel the coat and then go back to kind of look at the skin, looking for any bite marks, maybe from fleas or flea dirt. That's the poop from the fleas. And you also are feeling, for the ribs and stuff, is this animal too fat or too skinny? Then you have the integumentary system. That's the skin. So bald patches, rashes, any flaky skin that the animal might have. So you want to definitely take a look at all the skin. Try to see their belly as well. Sometimes that's where fleas tend to hang out. Hot spots tend to happen on the rear end of the animal. The musculoskeletal history of lameness. Violet was limping a few week ago, something like that. I think she had just chased a squirrel too hard and needed a few days to recover from that. But she did have a history of lameness there. Any broken bones would be part of the skeletal system. The circulatory system. So this is the cardiovascular circulatory system. Coughing. You wouldn't think coughing would have to do with the circulatory system, but it does. Having heartworms can cause an animal to cough. It can have some fatigue. Fainting, dyspnea, and heart murmurs are other things to listen for and look for with problems with the circulatory system. So a heart murmur, when you're listening for that lub-dub, 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 that's normal heart sounds. If you have a heart murmur, you would hear a lub-whoosh-dub, lub-whoosh-dub, lub-whoosh-dub. It would be that's the backflow of the blood running through the heart, and it may be a valve that isn't closing correctly and letting some blood kind of flow back through. Respiratory system, again, coughing, sneezing, any nasal discharge, exercise intolerance, and then cyanosis. That's that blue tinge, that blue coloring to the mucous membranes. That means that there's not enough oxygen getting through the system. Then we move on to the digestive system. So is the animal eating normally? Any diet changes? Has it ingested any poisons? Is there vomiting or diarrhea? Genitourinary issues, abnormal discharge or smell or color of the urine can lead us to signs of a urinary tract infection or even diabetes, something like that in the animal. Could be prostate cancer or problems. There's just a lot of different things. You kind of have to be a private investigator type when you're working with animals because they can't tell you what hurts. So it's you figuring things out and looking things over and paying attention to the fine details to figure out what's going on with this animal. Nervous system could be anything like seizures, behavior changes, a head tilt, difficulty walking. Lymph nodes could be swollen. So we have lymph nodes like in our armpits and then under our neck and then different places in the groin area and through the abdomen. So, if you're ever putting on deodorant in the morning and you're like, "Ooh, that hurt," that could be, a lymph node is working overtime because maybe you have some antigens that are trying to cause a disease and stuff, and your lymph system is kicking in and trying to fight them off. Sometimes when you get sick, your lymph nodes here in your under your chin really start to hurt. So that means they're kicking in, they're going to work, and they're trying to fight off whatever's trying to make you sick. It could be allergies too. Ears, any discharge or unusual odor could mean a yeast infection in the ears. Shaking of the animal's head, or have you ever seen a dog go across the floor and with their butt up in the ear, and or butt up in the air and their ears on the floor, and they're going across there, that means their ears are itching. Something's not right. They're constantly itching at those ears, or there's debris in there. The ears are either dirty or ear mites. All right, eyes. Excessive tearing or discharge drainage coming from the eyes. Visual difficulties. There's a cloudiness of the eyes. As animals get older, they do have some old age changes in their eyes, but it's important for you to make sure that you're checking them and the mucous membranes around the eyes. And that leads us to the mouth, the gums, teeth. Make sure the mucous membranes are pink and moist. If they're very red, that could mean toxins are flowing through the digestive system, the circulatory system. Cyanotic, that's that blue color, or pale, could mean that they're having some issues with their blood, the circulatory system as well. So those are the 12 areas to really look for, to start to get those clues to figure out what's going on with this animal. And so that you can bring those also to the attention of the veterinarian and say, hey, I keep an eye on these things and this is different. So it can help the veterinarian come to a consensus as to what's going on with the animal quickly and effectively and efficiently. And these are all very good things to keep an eye out for. All right, that is it for your lecture. Let me just cruise through the notes here. I think we covered things pretty well. If you need things in writing, they are here in your notes. If you need to go back through and listen to this lecture again, it is here for you in Schoology. So, all right, guys, thanks a lot. I'll see you later.